effective strategies to help folks with dementia live a higher quality of life. We're not going to cure anyone with dementia, and that's not why we're here. But we are here to help folks understand that there is hope in dealing with dementia. So what Lanny's offering is a framework to evaluate and get in front of dementia in terms of dealing with it early in the disease process, and then educating caregivers to know what to do as the patient progresses through those 7 stages, if you will.
Oftentimes, therapists do not believe that a person can be independent in self-care. They don't see a person, they actually see a diagnosis. The person is always there. And so what I tell therapists all the time is, the truth is, people can be continent till the very end of life. They can continue to do all their self-cares independently, but they can only do it their way. But you've got to slow down. And probably the biggest thing you need to realize is every time you ask somebody to do something, by the time they're in late mid-stage dementia, there's as much as a 90-second delay in processing. And so most therapists won't wait even 30 seconds for a response before they're pulling on somebody or they're trying to get them to do it traditional ways. So I say slow down, see that there's a person there, try to enter their reality, and only good things are going to happen.
Lanny really opened my eyes as far as from the neon green color that the patients can see, up to the way you approach a patient and the way that you do the 90-second wait to let them know that you're approaching them and give them time to answer their questions. It was very eye-opening, and it's definitely some things that I'm going to take away, not only for patients in the future, but also for family members that I have that have recently been diagnosed with dementia.
I'm very excited to go back and say, oh my gosh, wait till you try this. Look what we've learned, try this, think at it from this perspective. So yeah, I'm very excited to take this back and share this not only with the staff, but also the family members.
What we're mostly about is teaching caregivers, but these are practical methods that we can teach our caregivers. These are not theory. This is actual practice. This is how to help your loved one not to be incontinent. This is how to help your loved one to be safe in their home and to not, have a fear of them wandering away. Enter their reality was the buzzword that was given to us, and that's the thought that I come away with. How can I enter their reality in order to smooth the waters, allow me to enjoy the remaining time that I have with my loved one, and feel that joy that you still have with that person being in your life.
When they can identify this as not a disease, but as a person, it opens the window of opportunity for not only that person and their family, but for the therapist as well.
Part of our mission to educate the entire community on the latest and greatest techniques that don't necessarily require prescriptions or a hospital stay to prolong the quality of life for people living with a chronic illness. And so we spend real time and real money bringing in the experts from around the country and exposing them to this community to help patients, doctors, family members, caregivers be more effective.